Medical news tonight. 2020 has important news that virtually every American adult should know about. Researchers believe they may have found an explanation for some of the chronic fatigue, headaches, and depression that affect so many of us. Now, those conditions might not sound so horrible, but for some chronic sufferers, life is not only horrible, it seems at times hopeless, especially since doctors often can't diagnose their problems. And that's why this development is so important. ABC's medical editor, Dr. Timothy Johnson, has this news, important to the whole country, but already of special interest to certain communities.
The waves of Lake Tahoe, Nevada, appear almost angry this May morning. The turmoil of this usually calm lake is perhaps symbolic of the turmoil facing many residents in this resort community, a turmoil created by a medical mystery that has haunted and frightened many people here for a year and a half. People like Chris Guthrie.
It's not getting better, and that scares me. I have a little 6-year-old, Sean, who says to me at night, "When are you going to get better?" And I have a hard time answering that question for him.
Chris, a 34-year-old mother, also has a job with the power company. She used to be an active, productive person, both at home and at work.
I think I was a much different person. I could do a job of walking 10 miles a day, feel full of energy, come home, do things with my son, cook dinner, spend some time with my husband, and then still on the weekends go skiing. And I could do that.
Chris Guthrie can't do all that anymore because for the past year and a half, she has been sick with a baffling and frustrating illness which came on very suddenly.
I was very tired, had, again, bronchial problems, insomnia, the headaches continually. Then I started waking up just being in pain every day, whether it be backache, joint ache, and it was getting very difficult for me to perform.
Now she must nap every day by 4 o'clock. She rarely goes out socially anymore, and her husband often must fix dinner because she is simply too tired.
I come home, she's already on the couch. She's had it for the day. And even though she hasn't been at her outside job, just trying to do what she can around the house. And it bothers me because I know she would rather be able to do it.
Dr. Paul Cheney, an internist at Incline Village, Nevada, is Chris Guthrie's physician. In the fall of 1984, he and his partner noticed that a lot of people were coming in with the same kind of flu-like symptoms.
Their physical exam was not very remarkable, for the most part. Certainly compatible with a viral illness, and we felt that it would soon go away, as most viruses do.
But Dr. Cheney was soon puzzled. The symptoms did not go away, and they began to look more and more like the infectious mononucleosis seen in teenagers.
We were unaware that you could have an outbreak of mononucleosis in adults. We were under the impression, and all the literature that we had available to us would indicate that this is a disease that is isolated.
As time passed, the number of patients with these symptoms grew, and there were clusters of outbreaks. A group of teachers at a high school. Another group at a local casino hotel.
To see this many people coming in whom we knew in accelerating numbers through the early spring with a chronic fatigue syndrome and associated other findings, that we then began to be alarmed.
In fact, medical researchers have described scores of outbreaks similar to the one in Lake Tahoe. There have also been scores of explanations ranging from pesticides to mass hysteria to various infectious causes. But in recent years, increasing attention has been focused on the possibility of persistent viral infections, not only in clusters of cases as in Lake Tahoe, but in hundreds of thousands of individual patients. And one virus has been getting special attention, namely the Epstein-Barr virus, named after the researchers who first described it. At the National Jewish Center for Immunology in Denver, Dr. James Jones has been studying the Epstein-Barr virus. He and many other scientists are intrigued by the possibility that this virus, which causes infectious mono, and which almost all of us have picked up while growing up, can somehow reactivate in adulthood.
Since 90% of adults over 30 have been exposed to this virus, there is a huge pool of virus, in essence, in the community. The virus lives in us, in all of us who have ever been exposed to it, in a latent form. and it becomes periodically reactivated so that it produces itself. When it reproduces itself, we respond to that, and we become ill.
However, the first time that many physicians became aware of this possibility was early last year when two provocative studies were published in the January 1985 Annals of Internal Medicine. The articles, one of which was written by Dr. Jones, stated that the virus, quote, may be associated with chronic illness in adults. Because this possibility is so new, many doctors haven't heard of it. That has opened the door to extensive misdiagnosis. We spoke with some of Dr. Jones's patients about earlier diagnoses made by other physicians.
They thought that I had a thyroid problem or a blood sugar problem, menstrual syndrome.
Suggested it might be multiple sclerosis, and that seemed to be what their principal focal point was.
He said I had a nervous stomach, and I just about cried when he said that.
You know, one doctor said, well, maybe you have a brain tumor, but I'm not going to check on that right now.
Actually, we shouldn't be too hard on doctors who don't think of this syndrome. After all, it wasn't described in modern form until last year, and all of the classic symptoms could easily suggest other diseases. Indeed, these symptoms sometimes lead physicians to conclude that the patient is imagining the problem or simply needs medication to calm down. Brenda Langworthy, a high school student from Rawlins, Wyoming.
Lots of tranquilizers. They thought it was mostly psychological. So they'd give me things to try and help me cope with stress.
What is particularly frustrating for these patients is that they were active, aggressive people who before their illness were full of energy. Then, rather quickly, it all changed. Susan Michaud, mother of three, was an active career woman.
I guess you could say I was what they called the superwoman, the career woman. I had the children, you know, and I could do everything. I was social director for an oil corporation for Denver when I worked there as an office manager for a number of years. I was very, very active. I had no problem balancing it all, and I loved it.
Susan's home soon discovered the tragedy of the syndrome. Now, 8-year-old Nicholas must do the vacuuming, and his 9-year-old sister, Angela, does the dishes while their mother rests. Because of her illness, she can't work, and they all must live on a lot less than the $25,000 office manager's salary she used to get. But Susan not only lost her job, her marriage was also destroyed. Both she and her ex-husband, Randy, agree that the illness played a role in their divorce.
We did have such a good relationship, and then as the illness became more and more pronounced, it did take about a 180-degree turn.
There was no communication after a while. There was no reason to understand what was going on because there was no medical backing for it.
You know, at times that we would have little spats about, you know, things of, well, you know, what's really wrong with you or something like that. You know?
It was like, you know, you're my pillar of salt, and you don't believe me either. You know, I felt very, I think, vengeful towards him, very angry, it was like, get out of my life.
Broken marriages, careers ended, and rejection by friends.
People pulling away from you hurt so bad that it takes a long time to deal with it. I still can't. I get really mad.
I think the worst experience I had was with a couple with a new baby. And they had found out, this was at my son's school, that I had this Epstein-Barr virus, and I went over to try to see the baby and, you know, possibly hold the baby. And they said, oh, no, please don't.
For some patients, all this rejection plus the constant illness is overwhelming.
And you're scared and you're confused. You know, why am I doing this to myself? You know, what's wrong with me that I'm making myself this ill? And suicide sounds like a pretty reasonable alternative when you're that sick.
Daryl Anderson, 54 and father of 4, is a real estate consultant.
I got in my car and drove up the highway, headed up for the mountains. I was going to drive off a cliff. I mean, that's absurd. But that's really the way I felt. It wasn't a matter of trying to get back at or anything. I just wanted to end it all.
Nomi Antleman of Tucson, Arizona, says she also was ready to take her life. She had suffered 5 years of illness. One of her misdiagnoses led to the removal of her spleen, which made things worse. And she still didn't know what was wrong with her.
I couldn't face another doctor saying
you're suffering all of this, you're doing it to yourself, think positively, you're crazy, you're neurotic, whatever they had to say. And one day I simply decided that I had to be released from the pain that I was suffering. And the only release that I could see was suicide.
Fortunately, Nomi located Dr. Jones, who eventually told her that she appeared to have a case of chronic Epstein-Barr virus infection, often abbreviated as CEBV.
And I said, there's a name for what I have. I said to him, you've saved my life. And at that time, I don't think he really understood that I meant, you have saved my life.
However, there is considerable debate as to whether or not any doctor can diagnose chronic EBV for sure. That's because, like so many other diseases, for example, arthritis, there is no specific diagnostic tests. The tests currently used measure antibody responses to the virus. Sometimes patients with classic symptoms show abnormal levels, but sometimes they don't. Researchers at Boston's Brigham and Women's Hospital are now testing blood samples from Lake Tahoe patients. Dr. Anthony Komaroff, chief of general medicine, says the results can be confusing.
And some patients who look clinically as if they have this condition do not have abnormal antibody levels, and vice versa. Other people who feel healthy have what we would call abnormal antibody levels.
In fact, the Centers for Disease Control in Atlanta has recently suggested that doctors who think patients might have the EBV syndrome should keep looking for other conditions. However, doctors who take care of these patients have a somewhat different view.
What impresses me is just listening to some of the patients, to hear a patient who tells you a story that they were feeling perfectly fine, and then all of a sudden they got some sort of a viral flu-like illness, and ever after they have not been the same, and that's been going on for months or years.
But once the diagnosis is made, what then? Unfortunately, there is no proven treatment for CEBV. So for now, some patients are trying experimental therapies.
My view on treatment is that I don't know enough about this illness to rationally recommend treatment.
So what hope do these patients have? It should be noted that, however debilitating, the illness is, in and of itself, not fatal.
And I'm glad that Mommy is going to be well soon.
And what both experts and patients stress as critically important is the assurance that whatever they have and whatever causes it, it is real.
And it's a very scary thing, but it's very real. If it was imagined, my imagination could do a lot more fun things than this. And this is not fun. I want to get back and do things the way they were before. I just want it to be normal.
It's a reasonable desire. Is there any hope in the offing that these people might be able to become normal?
Yes, I think the fact that so much of the medical profession and medical science is now recognizing this as a real problem, even though we don't have good answers yet as to causes and therefore treatment, does provide hope. And as the piece indicates, the most important thing for these people is to be acknowledged as having a real problem. That does provide some hope.
In the meantime, what should they do?
Well, there are a growing number of physicians throughout the country who are recognizing this and becoming interested in it. And I think people are just going to have to seek out those physicians in the various cities of our country who will acknowledge the problem as a real one and give them the support until better answers come through.
Very good. Thank you.